I have been a hand therapist for 13 years, and I've been here at Ortho Montana for the last 7. I work for all of the physicians here, but work most closely with our hand COE doctors, Dr. Costanzo, Dr. Settigren, Dr. Llewellyn, and then kind of bleed into our sports medicine COE with some elbow and some shoulder stuff as well. But all of our doctors pick up all kinds of things on call, so essentially in the end I work with and for all of them. I can't imagine doing any other aspect of therapy at this point. It's very similar to what most people have in their head what a physical therapist does, but we only treat fingertip to shoulder. So we see everything from conservative treatment, you might have tennis elbow and we would see you for therapy for that, to very traumatic post-operative rehab, anything from amputations to tendon repairs, fracture repair, on up to rotator cuff repair. Working at Ortho Montana has been a really great experience for me. Prior to coming here, I worked in private practice in Spokane, Washington, and in all honesty, I was a little hesitant to come back to Montana. I grew up in eastern Montana, so it was sort of coming home, but I had been practicing in Washington for 5 years at a really busy clinic, seeing a lot of great things, and I think it's just human nature to assume that when you're in a bigger place, you're seeing bigger things, and so I was a little worried coming back to Montana that it wouldn't be as exciting, it wouldn't be as complicated and fulfilling. And I was so wrong. If anything, it's been the opposite. Our doctors see everything, and they are incredible at what they do. And I've had so much more exposure and learned so much more. And so just being here and being a part of this group, I've learned so many things that I otherwise don't know if I would have ever had the opportunity or exposure to learn and better myself at. You know, doctors are just like everyone else. They're just people, and they have their own set of passions and their own families and their own lives too outside of their time here in the office in the operating room. And I think that it's easy for them to connect with our patients, whether it's because their kids are on the same Little League team or they have, you know, ski interests, or there's so many things that you know, they're here in Billings and in Montana the same reason that all of our patients are. I feel like the patient care couldn't be any better because of the close collaboration and communication between all of the providers.